Good afternoon. Today I will be discussing ADHD, what it is and what causes it. Is it just that kid that can't seem to sit still and is always fidgeting somewhere in a corner? Today I will answer some of these questions and many others. Attention Deficit Hyperactive Disorder is commonly known as ADHD. Its original name was Hyperkinetic Impulsive Disorder until the early 1960s, where they recognized it as a mental disorder. In order to avoid confusion between these two names, I will be discussing ADHD. According to the NIH, National Institute of Mental Health, in an article on ADHD, they explained to us that the definition of ADHD is a brain disorder marked by an ongoing pattern in attention or hyperactivity, impulsivity that interferes with the function and development. Generally, when people who are diagnosed with ADHD, they have low dopamine. The website Simply Health, in their article Understimulated from Low Dopamine, give an example of people with ADHD as people lacking water in a desert. There is no one set reason as to why people get it, but the most common is due to genetic roots. Others, although not as common, may include smoking as well as environmental toxins such as lead. The average age to be diagnosed is 7 years old, with males being diagnosed more than females. As of 2011, 11% of children between the ages of 7 and 17 were diagnosed with ADHD. ADHD is often mistaken as an emotional or disciplinary problem and usually results in delayed diagnosis. The diagnosis process does not generally happen until the person causes significant problems at home or in school. In order to diagnose someone who is suspected of having ADHD, the suspected person must go to the primary doctor as well as psychologist. It is easier to diagnose a child rather than an adult. The test that is performed is a checklist of symptoms as well as questions about past or present problems. The doctor then checks how severe the symptoms are, how long the symptoms have affected the said person, and where and when the symptoms occur. Those who have ADHD are more prone to have other issues such as anxiety, depression, and substance abuse. Although there is no actual cure for ADHD, there are ways in which it is kept under control. The most common way of keeping it under control is through medications such as chloroquine, atoxetine, and many others. According to WebMD, the medication helps by acting as a stimulant and managing their short attention span, impulsive behavior, and hyperactivity. Although medication is helpful, there are alternatives other than medication, such as psychotherapy, such as behavioral therapy. The goal in behavioral therapy is to help the person with ADHD as well as the family around to manage everyday struggles. There are also other forms of getting help other than medication that is suitable for the entire family, such as parenting, skill training, stress management techniques, and support groups. This type of help can give everybody in the family a better understanding of one another and especially have a better understanding of the individual.